Did you know that insulin resistance can actually be brought on by chronic stress? Want to know exactly what insulin resistance is and what to do about it? Well then, just keep watching. Welcome to my channel. My name is Dr. Jessica and I am a naturopathic doctor, an acupuncturist, and a health coach. And I help clients deal with stress, anxiety, fatigue, and other symptoms of burnout. Let's jump into insulin resistance. So what is insulin resistance? Well, we need to talk about exactly what insulin is and what it does first. So insulin is a hormone that's produced by our pancreas. And the basic job of insulin is to tell the rest of the body, hey, sugar or glucose is here, let's open up the gates and let's let it in. Now, when we become insulin resistant, that actually means that the body is still, or the pancreas is still creating insulin, but the rest of the body, or those gates or those channels, are not really opening, and the body's just kind of like, meh, so sugar's here, so what? And it doesn't get let into the cells as it should. Generally, we want the body to be more sensitive to insulin so that when insulin gets produced by the pancreas, the body responds. That way, the pancreas doesn't have to keep going and going and going and producing more and more and more. And the reason why we don't want more and more and more insulin being produced is that eventually you can burn out those cells in the pancreas that create insulin. The thing that's so scary about insulin resistance is that it often leads to things like prediabetes and then into type 2 diabetes as well. It can also cause an increase of abdominal obesity, increased risk to cardiovascular disease, and is also linked to chronic conditions like PCOS. So what causes insulin resistance? Well, it can be multifactorial. A lot of times actually chronic stress and chronic release of cortisol makes your body less responsive to insulin as well. And that's why it's so important to make sure you're doing everything you can for stress management, because again, you want your body to be responsive to insulin. We can't always be in this hyper aware state or this hyper stressful state because it does cause other metabolic processes to slow down. Other things like a poor diet, following the traditional SAD or standard American diet, is another contributing factor as well. So the next question becomes, how do we measure it? How do we know? Well, a simple and easy lab test that you can order, you can have your doctor order it for you, is fasting insulin. If we're in a fasted state and we're not eating anything, our body's not receiving any nutrients, then insulin should be low because there's no signal to send, there's no one to tell that sugar is here because there's nothing there. Obviously, you don't want to just take one measure, so I usually combine this with the hemoglobin A1C as well as a fasting glucose to get a more complete picture about what the body is doing. But these are simple, easy lab tests that you can order online yourself, or you can work with your healthcare professional. I definitely recommend working with a professional because they're gonna know how to actually interpret these values and then what to do about it, which brings me to my next point of, well, how do we treat insulin resistance? If you've been on this channel before, you know it's gonna begin with dietary and lifestyle changes as well as stress management. One of the first things you want to do is you want to look at what you're eating. Are you eating well-balanced meals? Are you overeating? Are you undereating? Are you making sure you're getting all the nutrients and vitamins and minerals that you need from your diet? One of the things that I really love to do is actually look a little bit deeper with my clients and maybe use something like a continuous glucose monitor. This actually will help us dig a little bit deeper and go more specific and more personalized because it's gonna let you know what foods in particular are kind of spiking your glucose and what foods are having that sort of insulin resistant response. So that's one step, is to really just look at your nutrition and take a deeper dive if necessary. Number two, of course, exercise. We want to be reducing cortisol overall. We want to do more resistance training more so than cardio. Cardio is great for other reasons, but when it comes specifically to increasing our insulin sensitivity, doing resistance training has been shown to prove very, very effective at increasing that insulin sensitivity. So it would be great to add in some resistance training at least 2 or 3 times a week. This tip is also great for the women out there who are suffering from PCOS. After dietary and lifestyle changes, then we want to look at stress management. Again, we want to do everything we can to bring down cortisol because cortisol is going to make us less sensitive to our insulin. And when I'm talking about stress, I'm talking about chronic stress. Chronically living in that state of feeling tired, burned out, fatigued, and just go, 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 and really just pushing your body too much. So you want to look at things like mindfulness, maybe things like breath work, things like, again, exercise, all things that you can do that are lifestyle dependent and really mindset focused to bring down that stress level. When it comes to that stress management, it is one of the main things that I deal with inside of my coaching practice, the Better Health Blueprint. We go deep into ways to get you to de-stress. We look at your mindset, we look at your nutrition, we look at your exercise, we troubleshoot your sleep, and then we dig deeper looking at some of those functional tests and other lab works, things like that fasting insulin, looking at your glucose, your hemoglobin A1C, and combine all those pieces to create a tailored program for you. And I'm always there weekly to check in with you, to answer any questions, and to help troubleshoot and to help guide you. So if you're interested in learning how you can join me in my virtual coaching program, or you feel like you need some extra guidance, then why don't you click the link below and you can book a time. We can set a time to talk about the program and see if it's a good fit for you. Now, let's jump into the last method of treatment when it comes to insulin resistance, and that's of course medications and supplements. Now, kind of classic first line treatment would be a prescription called metformin. That is one of the standard treatments, especially for those insulin resistant people who are already pre-diabetic or diabetic. I can do a whole video and diving into the different types of treatments as well. If you want, just leave a comment below. Then there are other herbs and supplements that also help the body become more sensitive to insulin. So those are things like berberine, those are things like chromium picolinate, and also things like inositol. Again, everything is going to be dose dependent, so make sure you're working with a qualified provider that knows how to regulate these things or either knows how to prescribe certain medications. So in summary, when looking at insulin resistance, first you want to look at your lab work and see, like, are you actually maybe a little bit insulin resistant? And then we need to think about ways to make you more sensitive and to increase that insulin sensitivity. So again, working with your nutrition, working with your stress management, and working with your exercise and your dietary changes is a great way to get started. And then from there, working with a provider to work with either herbs or supplements that will also help with that picture. All right, I hope you found this video helpful. If you have any questions, for sure leave them in the comments below. Be sure to like, comment, and subscribe, and give this video a thumbs up because it really helps other people find this channel. So I will see you in the next video. Bye.